live.
Okay, thank you, Justin. This is the convening of the Central District Board of Health meeting for Tuesday, December 1st, 2020. It is 5:15 p.m., and I am the presiding chair from Elmore County, along with Representative Megan Blanksma. I will go ahead and call the meeting to order at this time and take roll call by county, starting with Boise County. I don't hear Ryan. Valley County.
Commissioner Hasbrook here.
Elmore County.
Representative Blanksma, present.
Ada County.
Jane Young, present.
Ted Epperly here.
Michelle Achando here.
Okay, thank you, folks. Proceeding on with action items on our agenda. Russ, are there any changes to the agenda?
Madam Chair, no changes to the agenda today. Thank you.
Okay, thank you. Okay, moving on to new business. We need to entertain a motion, have a vote to approve the minutes from our November 17th, 2020 board meeting. Are there any corrections or additions to those minutes?
They look good to me, Madam Chair.
I'm sorry, Elsa, I couldn't hear you.
I'll make the motion. We approve those minutes.
Okay, thank you, El.
I'll second. This is Jane.
No. Okay, and hearing no corrections or additions to those minutes, I'll call for a vote by county, starting with Boise County. Valley County.
Commissioner Hasbrook, aye.
Elmore County.
Representative Blanksma, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Michelle Achando, aye.
Okay, thank you, folks. Those minutes from our November 17th board meeting stand approved.
Madam Chair, this is Russ.
Yes, Russ.
I just wanted to let you know that Commissioner Sturm just joined, so he's in the meeting now.
Thank you. Hi, Ryan. Thank you for.
Hi, everyone.
Okay, we're just ready to move on for a review of COVID-19 metrics for criteria, determining quarantine and restriction orders for Ada County and COVID-19 activity in Boise, Elmore, and Valley counties by Kimberly Link, our communicable disease control manager. Kim, welcome, and the floor is yours.
Thank you, Madam Chair. So the first, we'll go through these slides in the same order that we have been. I'll give the titles for those who don't have access to the web share. The first slide that we're looking at is titled Central District Health Ada County Criteria Summary. What I want to point out in the higher level analysis is that our hospitalizations are remaining quite high. In addition, our case numbers are continuing to be quite high. We're in the position right now that our data entry has been delayed. We're working in the case of a backlog, so trying to get cases out for investigation while still working through lab reports that are coming in. So right now, I'm able to report out estimates for the number of cases that are being reported each week. We're sitting typically over the past couple of weeks in about the 3,000 case range for Ada County residents. In terms of our clusters and outbreaks of note, the one area that I do want to point out is long-term care facilities. We've been seeing really over the past month and a half, a slow and steady increase in the number of facilities that are being impacted. So as of the report that was published on the Health and Welfare Coronavirus website on Friday, we have 46 long-term care facilities that have active COVID outbreaks. This is up from 43 last week, and if I recall correctly, 39 from the week prior. So again, we are seeing significant impacts to long-term care facilities. We continue to be in a position of seeing widespread community transmission, and our trends are just continuing to head in the wrong direction. Next slide. So this is the slide that's titled Hospital Criteria. On the left-hand side, we have the bar graph. This is for Ada County residents hospitalized for COVID who are not receiving ICU care. And then on the right-hand side is the trend line. as you look at the trend line on the right, you'll see that it is reasonably flat. We haven't been seeing large changes in our Ada County residents who are not in ICU care. But I do want to point out that when we look at the bar graph on the left, as we look at the entire month of November, you'll see we started out the month with 25 people who were admitted for COVID. We're ending this month in the high 60s, with many days where we were above 70 people who were hospitalized as a result of COVID. So we've seen dramatic increases in our hospitalizations over the past month. And right now it does seem that in terms of those patients needing to not be in ICU, that we're having relative stability in that. But again, the fact that these hospitalizations remain so high is definitely of concern, and especially as we continue to progress into winter, knowing that we're going to be getting into flu season, RSV season, and any other number of things that make hospitalizations increase over the winter. So while the trend line remains flat, definitely of concern. You can scroll down to the next set of graphs. Thank you. So the set of graphs that we're looking at that are now at the top of the screen are Ada County residents who are receiving ICU care as a result of COVID. If you look on the right-hand side, our trend line is going upward. What we've seen is over the past month, a little bit more of a dynamic situation in terms of ICU care, where earlier in the month we saw some increases. Mid-month, those numbers dropped down a bit. And now as we move into the later part of November, we're seeing those numbers increase again. Definitely a very concerning trend, especially knowing that ICU capacity is a limited resource here as we look at not only the beds that are available, but also the staff to be able to provide care for these patients. So I'm hoping that this upward trend does not continue, but there's no reason that it wouldn't really at this point. As we look at the bottom sets of graphs here, on the left-hand side, we have, this is looking at our Ada County hospitals, so not necessarily Ada County patients. This is people who are hospitalized, non-ICU care. And the growth that has been occurring over the past couple of months is pretty astounding. Again, a continued increasing trend as far as looking at overall hospitalizations due to COVID. On the right-hand side, this is Ada County hospitals, again, not necessarily Ada County patients who are in ICU care as a result of COVID. Again, what we can see is that as we look at November, those numbers increased. We did see that little bit of a dip mid-month as we saw with Ada County, but again, those numbers are right back up higher than really we've seen them before, which is, again, an unfortunate trend item that has no signs of necessarily slowing down. Next slide. So this is a slide titled Disease Criteria. Given the fact that our data entry is delayed, it's backlogged at this point, I did rearrange the information included in this slide. So what I wanted to point out is at the top of the slide, we have the confirmed and probable cases, Ada County residents by week of report. The week that has the number 2,725, that's the week of November 8th. We have full data through that week. The following 2 weeks, we are continuing to fill in data for those weeks. We're looking at case numbers that are around 3,000 to 3,200 cases per week in both of those weeks. I think that we might see a little bit of a decrease in the number of cases reported last week. Unfortunately, I don't think that has anything to do with fewer people being infected with COVID, but I think it has to do with the fact that we had the Thanksgiving holiday and less access to testing on that day, or less interest in going and being tested on that day. So again, I anticipate that those case numbers are right in the range of 3,000 cases per week. And we are working as hard as we can to get full information out so that it's available not only to you as members of the board, but also to the public as well. If you could go down to the next set of slides, or the next set of graphs, excuse me. So these are our daily case numbers. Again, as we look at these, the numbers past about the 14th, 15th of the month, we are still continuing to finalize those at this point. So that decrease in the numbers at current just has to do with the fact that we haven't been able to make those cases. As the data gets filled in for weeks, we'll increase those, or we'll include the trend line information. Again, just knowing that total case numbers are going up, I anticipate that the trend lines will go up as well. One thing I do want to point out with these graphs is that we can anticipate seeing some changes, or some differences, I should say, between those of the county as a whole versus when we're taking out Department of Corrections. We've seen that there have been a lot of positive results coming out of mass testing that's going on at corrections. Unfortunately, we're seeing facilities that are continuing to be impacted with new and ongoing outbreaks. So we will see some differences between those two graphs moving forward. Next slide. So this is the slide that's titled Ada County Case Rate and Percent Positivity Information. The Ada County case rate you'll see for the week of 11/8 is at 72.28. That is a final case rate for that week. As we look at the following the two rates on the following 2 weeks, those are interim at this point. They'll continue to increase as we get those case numbers in. Right now, I'm estimating that those case rates are going to be somewhere in the range of 80 to 90 per 100,000. So unfortunately, continuing to see that upward trend in our case rates as well. If you can scroll down to the bottom portion of the slide. So as we look at our percent positivity information, unfortunately, we saw that percent positivity for the week of 11/15 was just shy of 18%. I believe it was 17.7%, which is a new record high for us for percent positivity. We're seeing that the testing that's going on right now is higher than it's ever been. We did see a little bit of a dip during the week of the 15th, but overall, our testing is quite high as compared to what it was before. Unfortunately, it's not high enough to get a good grasp on the true level of illness within our community. We would be able to say that we have a good idea of the number of people that are truly becoming ill if we had a percent positivity that was in the range of 5%. We're now shooting toward 20% positivity. So unfortunately, everything that we're seeing in terms of number of reported cases, we need to realize is a tip of the iceberg type situation, and that there are many more people out in the community who are ill who had not been tested for COVID. So again, an unfortunate trend line that we're seeing and heading in the wrong direction. And I believe I did update our slide deck for this meeting compared to what it was before. So this is the last slide that I have prepared. One thing that I do want to point out, I know I've received in the past couple of days a number of questions about clusters. It sounds like there's been some national reporting and other health departments that have talked about where clusters of illness are occurring. Unfortunately, the situation that we're at right now with the case numbers being as high as they are compared to the size of our population, we're no longer in the position of being able to detect discrete clusters. That ability really goes away when we get beyond about 500 cases per week. And as I mentioned, we're sitting at about 3,000 cases per week. We're in this situation where we truly have widespread community transmission that's occurring. We've gone through phases where that risk of being exposed to COVID is increasing, based on whether or not a person is going out into a public space or to their place of work, to their school. And now we've reached the point that there's so much illness in the community that risk of illness or that risk of exposure is occurring anytime people are spending time with people who live outside of their own household. And that was really the basis of the language that was used in the public health advisory and why it was so wide sweeping to say that if people are doing activities that are not essential, we really need them to stop doing those activities, because that risk right now is so high to be exposed just from going and living what had been normal daily life, unfortunately. And again, as we look at this, our numbers in terms of number of cases, number of hospitalizations are both heading in the wrong direction. And we really need to see these numbers turn around in order for us to be a healthy community. And again, as we look at vaccine, hopefully being right around the corner, having that opportunity to vaccinate as many people as possible and protect as many people as possible. So with that, that's the end of my report. I'm happy to take questions.
Okay, thank you, Kim. The floor is open for questions for Kim.
Chair, this is El. Sorry, Dana, go ahead.
Yes, El, go ahead. Go ahead.
Well, I guess what I'm hearing on the street is from a lot of folks now is that I've already had COVID, so I don't have to worry about it anymore. And I'd like to know Kim's reaction to that.
So, Madam Chair, Commissioner Hasbrook, that is something that we still don't know enough about COVID to say really what that risk is for individuals. We know that there is a risk of reinfection. We're seeing it happening. And unfortunately, we don't know how many people will potentially become reinfected with COVID down the line. So I think it's imperative on everybody to continue to take the actions to protect yourself and protect those around you.
Thank you.
Any further questions for Kim?
Yes, this is Diana. Thanks, Betty Ann.
Yes, Diana, go ahead.
Kim, could you go back to the slide? I would like to compare. Like I said last time, we got started doing just Ada County back in the summer when we were really the hot spot. But this is a statewide thing now. And I'd really like to take a look at the hospitalizations of Ada County residents versus those in Ada County hospitals.
Sure. Dustin, could you pull up that slide?
Okay, so we have 67 Ada County residents. And then if you can scroll down to District 4 hospitals. So just under double that. And do you know, Kim, are patients still being cohorted in Ada County in the St. Luke's system, or are patients being seen for COVID or being hospitalized in Elmore and Valley County?
Madam Chair, Commissioner Latiando, I don't believe that St. Luke's, Elmore, or McCall are receiving COVID patients at this point in time. As we look at the facilities that are here in this area, they're being taken care of at the Boise facility, Meridian, and then Nampa.
All right.
Yes, this is Betty Ann. If I may interject here, Diana. St. Luke's manages both Elmore and McCall, and of course, COVID's a very specialized unit, and that corporate structure does not have COVID units in our hospitals.
All right, so we'll just continue to be at that tipping point here. My second question, if I may, Madam Chair.
Yes, go ahead, Diana.
So going back to the long-term care facilities, and this may bleed more into a conversation with Russ, so if it needs to, that's fine. Given that we've had this uptick, is the transmission still mostly coming from staff? It's not visitors now that we've allowed some visitors again? What are you able to ascertain that?
Madam Chair, Commissioner Latiando, from what we can tell in terms of new outbreaks that are occurring, that these are being largely happening through contact with staff. We had only a short period of time where visitation was allowed. That was something that, as my staff were interviewing people who had tested positive for COVID, they were asking the question of whether or not a person was going to a long-term care facility. We didn't find that any of these outbreaks were started as a result of visitation. I believe that there may have been at least one facility where it seems that the outbreak started by individuals who were traveling, residents going outside of the facility and then coming back. So having that exposure during a time that they were outside the facility.
So Russ, I think this kind of, we can take some of this up in your report, but I just don't know if one of our charges is to protect the vulnerable. It feels like we're not doing a great job of that. And I don't know. I know you guys are working with these places. I know they're required to wear masks now. Presumably they're all washing their hands. I just don't know what else, what else can be done. And I guess, again, you can get to that when you get to that in your report, but obviously it's not great for those residents who are affected, but then it's also certainly impacting our hospital numbers, and which has led to canceling elective surgeries, et cetera, et cetera. So, you can get to my question when you get there.
Madam Chair, I can answer that now if you would like.
Yes. Go ahead, Russ.
Yeah, so Commissioner Lasciando, I think the absolute best strategy to reduce the infections in the long-term care facilities, the vulnerable population that you mentioned, is to reduce the amount of disease in the communities. We're not seeing a lot of transmission occurring, just like Kim described within the facilities. We actually have sent out some inspectors to observe what's happening, and the facilities are doing a really good job with distancing and hand sanitizer, wearing the face coverings. But the bottom line is, when you have 3,000 plus cases in the community and the staff are community members, it's going to be next to impossible to keep it out of those environments, in my opinion.
Chair, this is El.
Thank you. Yes, go ahead.
Kim, another question, and it's kind of a hypothetical, but we're getting a lot of information now out from the national and from Dr. Fossey and some of these other experts saying that it's maybe time for the kids to go back to school full time and kind of let this pandemic evolve, so to speak, in the schools. And I'd like to know your feeling on that as well.
Madam Chair, Commissioner Hasbrook, I think that as we look at where we're sitting right now in our community, our schools, we know that Boise schools have already switched over to remote learning just because of the challenges of managing a safe school environment in the context of having so much COVID. And I think that there are some schools who are doing an absolutely great job of working through all of the policies and all of the processes of keeping kids safe. But where we are sitting right now is that we have a lot of school-age kids who are getting infected with COVID and then going into the school setting. And as that continues to increase, that risk of transmission in the school setting is going to continue to go up, even when schools are doing everything perfectly. So I think that it is a delicate balance that we're walking in terms of having kids in school at the time that our case numbers are so high. I know that, again, our schools are working very hard to provide a safe environment for these kids, but that risk, just because of everything that's going on in our community, is still there.
Chair, follow-up?
Yes, go ahead.
So Kim, can you kind of lighten our load a little bit here as far as what kind of issues we're dealing with as far as the staff at the schools? Have most of them already been infected, or most of them out, or how are they handling that? I read a few different articles about there's a shortage of substitute teachers, and they're dragging folks back in that aren't even certified to teach. Is that true?
Madam Chair, Commissioner Hasbrook, I don't actually know the specifics. I think our school task force, or perhaps Russ, might be in a better position to answer that. I know that our schools are definitely struggling. Many of them are with staffing, that we're seeing faculty and staff, again, being impacted just due to the level of illness within the community. And I think each school district is handling it in the way that they feel is best.
Okay, thank you, Kim. Any further questions or discussion for Kim? Well, hearing none, I thank you once again, Kim, for the information, and we will move on with our agenda to item number 3, which is a discussion and vote regarding potential action to protect life, health, and safety within the district as to the COVID-19 pandemic, to include potential amendments to current public health orders and additional orders for other counties within Public Health District 4 or a public health advisory. Russ, would you like to lead this discussion, please?
Sure. Thank you, Madam Chair. So we put this agenda item on all of our agendas. It's basically a standing agenda item because I think it's really important that we have the opportunity to discuss both the data, which Kim just shared, as well as any potential actions that we need to bring before the board for consideration. So that's, again, why we have the agenda item on for all of our Tuesday meetings. So as you've heard from Kim, the hospitals are definitely filling up with COVID patients. The trend line is steadily increasing, not just for residents of our district, but the hospitals accept patients from outside of our district, Magic Valley, from Canyon County and beyond. At this point, no hospitals have advised us that they are pursuing state authorization for crisis standards of care. So, as far as whether we want to move forward with orders at this time, it's certainly getting more and more concerning with what we're seeing. So right now, the orders for Ada County and Valley County remain in effect, as does the district-wide public health advisory that we issued on November 17th. So I just wanted to, take a moment and remind the board and certainly the public that while the advisory is not an order, it doesn't have the consequence of a misdemeanor citation like the orders do, but it is critically important that our communities follow the strong recommendations we had issued to avoid a crisis situation that I would say appears to be developing fairly quickly based on the case counts, the upward trend of the high positivity rates, and then the continual increase in hospitalization. So we did include crisis standards of care as a trigger point that we included in the advisory that would be the point at which I would come to you and say, hey, it's time we need to issue orders that you all would need to approve before they became final. But I think I stated this in the past when we talked about it on the 17th and maybe the previous board meeting, is that it doesn't necessarily mean we need to wait till that point. When you see the hospital impact here in the Valley, around the state, and around the country, it's not going to be an easy solution just to move patients to other communities. We're certainly the hub for the southern part of the state, south and southwest part of the state, as far as hospital care. So that's something we definitely need to keep in mind and not wait till we get to that point where it's point of no return. Crisis standards of care get implemented, and then care suffers for not only COVID patients, but across the board for everything else that people have happen in their lives that send them to the hospital. So I feel, obviously really strongly that if we have enough members of our community, including our businesses, who, if they think they need to wait for us to issue an order before taking steps we requested through this advisory, I think that's going to be a mistake. We really need to work immediately to slow the growth. We've pushed out the information through the advisory for all 4 of our counties, the steps that we need to take right now to avoid having more drastic measures taken in the future. And I really think if the trends continue in the direction they are, the advisory will be a starting point for what we'll need to do as far as implementing strict orders to try to slow this down. And I was just going to certainly open it up for discussion among the board members. But before I do, I wanted to take a moment to compliment Commissioner Sturm and his fellow commissioners in Boise County. I had the opportunity to visit with them this morning at their facility in Idaho City, and I was really impressed. I wasn't sure exactly what to expect because our communities have responded in different ways, but you're stopped at the door with a sign, you don't enter without a mask. There's hand sanitizer available. I was led into the facility and 100% compliance with the staff and with the commissioners as far as face coverings and physically distancing. And I think it takes leadership to do that, and especially where there's varying opinions on the subject. But again, my compliments to Commissioner Sturm and his fellow commissioners for setting a good example for Boise County. So with that, Madam Chair, I'll open it up for discussion around the orders or public health advisory.
Madam Chair, this is Ted.
Okay. Yes, Ted, go ahead.
Yeah, we have an absolute serious situation on our hand. This is a crisis, and it's imminent, and it's going to worsen. We've already seen the trend lines. They're going through the roof, both in terms of cases, hospitalizations, ICU admissions. The problem is going to intensify remarkably in the next 2 to 4 weeks. And the reason for that is Thanksgiving. We all got together. 50% of the United States citizens traveled somewhere for Thanksgiving, according to surveys. And so people got exposed. There are more cases. We already had an incredibly high background rate. So what's going to start to happen over the next 2 to 4 weeks is we're going to see these things go right through the roof. So we right now already are the second highest test positivity state in the United States. We're at 18% here. We have counties that are 27% test positivity, and 27 of our counties across Idaho is 27%. We have an absolute imminent crisis right now. So what the big deal is with this crisis is what it's going to do to the hospitals. Right now, today, as we talk, St. Luke's Magic Valley is on divert. St. Luke's ICU Boise is on divert. St. Luke's Meridian in their telemetry unit, which is a highly monitored unit, is on divert. St. Al's Hospital just went to red today. St. Luke's or St. Al's Nampa, St. Luke's Nampa are very close to that. That's today, let alone 2 to 4 weeks from now. We know with prevention, you have to act now to prevent what's going to happen 2 to 4 weeks from now. So what we are faced with at this moment in time is a decision we must make as a board for the good of this community. So I'm strongly in favor of moving from an advisory to an order that we could have Russ prepare, bring back to us at our next meeting on Tuesday, so that we could have Russ prepare this with his staff, understanding the situation, all the nuances of it. He could make sure that this is published to the community on Friday so the community can see this, have a chance to weigh in. And next Tuesday, I would recommend that we take action on the movement from the advisory to a public health order. If we do not do this, we will lose the hospitals. Hear me when I say that. We will lose the hospitals. We will go on a total divert in the Treasure Valley. We already know Utah's not taking, Montana's not taking, Nevada's not taking. That means by plane, we will have to transport people to Portland and to Seattle. And that's for routine hospitalizations, not just COVID cases. If you've got a stroke or a heart attack or appendicitis, you can't get in. We've got a major imminent crisis on our hands, and I absolutely strongly urge us as a board to move this from being an advisory to an order. I'll stop with that for now.
Madam Chair,
Thank
this
you,
is
Chair.
Diana.
Yes, Diana, go ahead.
So I understand this is a difficult thing to ask, Russ, but I go back to the slides that I asked Kim to show, which showed that here in Ada County, the heartbeat of healthcare for all of Southern Idaho, almost half of our inpatient hospitalizations are from patients not in Ada County. And we know many of them are coming from Southwest District Health area, which has shown no interest in doing anything. So based on your understanding of where the governor's office is going, will they do something beyond continuing to go back to the local control mantra? Because I'm tracking with with what Dr. Epperly's saying. We cannot get to a place where physicians are deciding who gets care and who doesn't based on age or whatever other thing. But I don't see how us just doing it here in our health district is going to be the thing that needs to happen. And also, it's unfair to our residents when there's not even a mask mandate next door. So I don't know, Russ, do you have any sense of that?
Madam Chair.
Yes, Russ, go ahead.
I really don't know exactly what the state plans to do. I know they're in continual conversations. They take input from the public health districts, as well as the state division of public health and the excellent team they have over there. But I don't know at what point it will get to before more strict steps will be implemented on a statewide basis. As you pointed out, we started out with a statewide stay home order on March 25th, and eventually that was transitioned to local control. And how we've seen it play out with local control is some health districts are, their boards are supporting actions in the form of an order, and other districts are not. So we definitely have an inconsistent approach. I wish I had a better answer and a better timeline, or the points that our state would have to get to in terms of hospitalizations in order for the state or for the governor to take action, but I don't know what that is.
Madam Chair, this is Al.
Yes, Al, go ahead.
But Russ, to kind of follow along with what Diana's saying, the only way that we're going to get the other health districts to do any kind of a mask mandate is on a statewide level, because they're unwilling to do it now. And now we're paying the consequences for it. It's really sad they let it go this far, and it's very upsetting. But my feeling is if we went to an order now, perhaps that would be the message to the governor that he's got to move faster on this. I don't know. What's your feeling on that?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Commissioner Hashbrook, I think we can only control directly what we can control, and that's the guidance and their orders and restrictions that we can implement within our 4 counties. I don't know, how that will impact other health districts, especially the neighboring health districts to the west and to the east. But as Commissioner Lasciando pointed out, half the cases are from outside of Ada County, but half the cases that are hospitalized right now are from Ada County and obviously from some of our counties like Valley County, Boise County, and Elmore County. So I don't think it's a good idea to wait for the governor to take action. I think we need to manage this the best of our ability within our own health district.
Madam Chair.
Yes, Ryan, go ahead.
So I would like to speak a little bit to letting folks know that, everybody here knows I'm in EMS as a side job, if you want to call it that. I have been experiencing in the last 2 or 3 weeks taking patients to the hospital who I know would require long-term care or further care based on their illnesses, and those patients are being transferred back home within days. Um, I mean, we're talking people who are having severe abdominal issues, who are having ulcer bleeds, GI bleeds, and they're being stabilized and sent home rather than previously having that same illness, and they're having that same illness previously and being hospitalized for 2 weeks before they come home. And now they're going back a year later for the same problem, and they're being hospitalized for overnight or 10 hours or 5 hours or whatever till they get stabilized, and then they're being sent home and told, you know, we did the best we could. We don't have the ability to dig into your issue currently. So that's just kind of where what I've seen with my own eyes, doing it from an emergency medicine standpoint. So it's just been really interesting and eye-opening for me. I do apologize to everyone. I actually have an ambulance call right now, so I will be leaving. But I apologize for everyone, and I just wanted to get that out there so that folks understand where I'm coming from, what I'm seeing as well. And thank you for the kudos, Russ.
Thank you, Ryan. Thank you.
So Russ, Madam Chair, this is Ted Epperly again.
Yes, Ted, go ahead.
Yeah, thank you. Since Ryan shared what he's seeing, let me share what I'm seeing. We're getting overrun at the primary health clinic level. We absolutely have a crush of patients coming in, trying to get in. Primary health, same circumstances. More and more of our employees are getting sick. We're having a harder and harder time staffing the clinics. Primary health is already closed 4 of their clinics because of the crush of patients. St. Luke's, and you probably saw this in the newspaper, was sending people out of the hospital on telehealth to manage them by telemedicine from their home. The problem with that is that the COVID cases can crash suddenly too, especially a sick COVID patient. It's not ideal, but they had to do it, not because they wanted to do it, but because of the room and capacity in their hospitals. Again, we're seeing an aggressive, rapid, and expanding community spread that will intensify in the next 4 weeks. I recognize in our advisory order that we put in place was if we got to crisis standards. The problem is if we wait until we're at crisis standards, then it's way too late. We need to act now to try to avoid crisis standards. Hence why I think we need to escalate as soon as possible from the advisory to the public health orders. And I'll stop with that.
Jane, you're on mute.
I'm sorry, somebody tried to speak. I couldn't understand that.
Betty Ann, Dr. Young is trying to speak, but she's still on mute.
Oh, okay. Well, Russ, this is Betty Ann again, and I would like to say that advisory and numerous meetings that Russ, Megan, and I attended in our county, the advisory did seem to make a difference. I did go through the Mountain Home community this morning, and I did see percentage-wise what I felt was a very good masking percentage in the general public and in our major retailers. Our numbers, I guess, countywide down here are looking somewhat better. However, I did not see that same situation at the courthouse. Was very disappointing. So Megan may want to weigh in on that whole situation for our county.
Yeah, all I would have is the same anecdotal evidence that you have, Betty Ann.
Betty Ann, This is Ted Epperly again. If we're ready, I'm ready to make a motion.
Go ahead, Ted.
Yeah, because of the rapid and continual escalation of COVID in our community, as seen by increasing cases to well over 3,000 cases a week now. Remember, the red zone for changing us out is at about 175 cases a week. We're at 3,000 cases a week because of the intensity of hospitalization, the intensity of the ICU admissions, the diversion of different hospitals. I recommend that we move from an advisory order to have Russ prepare a public health order that he and his staff can work on so we can get it as right as possible and bring that back to us next Tuesday so that he can share it with the community on Friday so that we can then take a look at what's in the public health order so that we can make the appropriate and definitive step. I would also suggest, Russ, that when we do this, that we look at an enforcement action on this in some capacity. It's gotten to that point, so please consider that as you prepare this of the public health order with enforcement. And lastly, I think it's got to apply to all 4 counties. I wish we could apply it to more counties, but we can't. But I think it has to apply to all 4 counties for consistency. And with that, I'll stop, Betty Ann.
Okay, thank you. The motion has been made. Is there a second?
Madam Chair, this is Jane. This is the second.
The motion has been made and seconded. I would ask for discussion regarding the motion before I call for a vote.
Madam Chair, this is El.
Yes, El, go ahead.
I guess my only concern, honestly, Ted, is that I don't think we can wait until next Tuesday.
Right.
I'm just wondering if we should be maybe thinking about getting together next night or two to get this approved. Another week is going to put us that much further behind.
El, that's a great point. Betty Ann, if I can just direct a question to Russ in regards to that.
Yes, go ahead.
Yeah, thank you, Betty Ann. El, thank you for bringing that up. The only reason I put it into our sequence was so Russ and the staff would have ample time to really thoughtfully put this together. But Russ, if you can expedite that faster and the public can be made aware of it faster, what are your thoughts, Russ, on doing that over the next couple days versus next Tuesday?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
We'll get it done quickly. We've already put together a draft based on the advisory and what that would look like in a form of an order for the 4 counties. The one thing that I do think is important is to make sure that the public has an opportunity to see what we're proposing, and definitely for all of our local elected officials to have the opportunity to see it, to comment on it, to know it's coming. So I think time-wise, I would suggest that we meet on Friday as a board. That would give us an opportunity to get this document finalized, posted for public comment, and then per usual, we essentially, we don't cut off public comment, but within 24 hours of that board meeting, which would be Thursday at 5:15, we would send the comments to all of you that come in from the public. So I'm just processing this. I think time-wise, that won't give a lot of time for the public to comment, but I guess I would shoot for giving them a 24-hour comment period, which would be tomorrow afternoon, having it posted and comment to be compiled at 5:15 on Thursday for consideration of the board on Friday evening.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
Russ, so you and I, tried to work with all of our jurisdictions here in Ada County around enforcement of the existing orders. And I, am really grateful for Mayor McLean stepping up on that. So to Ted's point, we don't have an army of central district health enforcers. So if cities are not enforcing, there's not a ton we can do. But I'm wondering if we're looking at having to again close down things, which no one wants to do, if some of those cities may be more interested in enforcement given that potential reality. So I'm wondering if there's a half step here before we actually have to shut down businesses again, or are we beyond the pale? What's your take, Russ?
Madam Chair.
Go ahead, Russ.
Commissioner Lasciando, I guess given the severity of the situation that we're all aware of at this point is, we'll have to figure out how to redeploy some of our staff who, do the inspection work, food establishments, childcare, swimming pools, et cetera, to have that resource, to have the eyes out in the community. And again, like we've talked all along, not that they're still occurring, the backyard barbecues, because they've moved inside with the weather. But I guess I look at it from the business community, people that really have control and large gathering, whether it's shopping centers or restaurants. I think we need to step up our efforts in those areas, particularly with the orders that we'll issue. If we don't have enforcement, then we, in many instances, don't have compliance. And one of the biggest issues that I've heard time and time again is businesses are incentivized in some instances not to comply with the order so they can increase their patron volume as people move from businesses that are doing the best they can. And I do believe that is occurring. We've heard that right from the start. So I think it's important that we get compliance. And the way to get compliance is to have inspectors out in the community doing the evaluations, reporting back to me, and I'll bring that to the board, just like we have planned for the couple of bars that appear to be blatantly disregarding the orders that we have in place. So I'll figure out a way to make that happen, as Dr. Epperly had requested.
So to that point though, Russ, what I'm trying to understand is, are we already in a place where we're beyond the pale and we have to punish the many because of the actions of what I would consider to be flagrant abusers or bad actors? Or do we still have an opportunity to utilize our own process and to get some cities on board to help before we have to shut down whole categories of businesses again? I just don't feel like you fully answered whether we're either or both at this point.
Madam Chair.
Yes, Russ, go ahead.
Commissioner Lasciando, my strong preference is that our cities would cooperate and follow what the city of Boise has done. And, they have the option to implement their own orders so that it's an infraction, not a misdemeanor. I think they've definitely made a commitment both on the education side as well as the willingness to enforce it. But that's just the city of Boise. We don't have that going on anywhere else at Ada County or anywhere else in our district. So I would appreciate your help, the commissioner's help from our other counties to make that happen. But I do recognize that it's going to take some time to get those processes in place. And in the meantime, I think we can start to do what we can on our end.
Thank you, Russ. This is Betty Ann again, and may I remind the group that some of us don't have law enforcement in our communities. So that's another piece of the puzzle. Or I should say part-time law enforcement only. We don't have full-time law enforcement like in Glens Ferry.
Here, this is Al.
Yes, Al, go ahead.
I think it's going to be more of a shocker, I guess you might say, if we take this from an advisory to an order. I think people are going to wake up and realize, oh, wait a minute, this is more serious than I thought. And I'm hoping that the mayors and the law enforcement and all those folks that are going to hear this and get this message are going to step up and do the job that they should do for the public. They should if they're going to be good leaders. Hopefully it'll wake up a lot of people and say, wait a minute, this is more serious than I'm giving it credit. I hope that works. But there's always going to be folks that are going to try and skip by and not believe in some of this stuff. And that's fine. You have to let the Lord kind of handle some of that stuff. Russ, my question to you is, part of this order, can we limit group sizes in businesses? Can we say no more than 20 people in a grocery store, or no more than, because I know like what we did it 2 weeks ago in our county. We sent half our workers home, and they're to stay home and work remotely, and they are the backup for the person that's at the courthouse. And if they come down sick and they have to go home, then they've got to come in immediately. They're on a 24-hour notice to come in and cover that job, to cover that office. And we're trying to spread our risk out as much as possible. Of course, it's full mask in the courthouse, and it's been working pretty well. I was up in McCall today to get some groceries, and at Albertsons and Ridley's and some of those places, and everybody had a mask. All the workers and all the folks at the cash register, everybody was really behaving well, and I was very impressed. So I think a lot of folks have got the message that, this is serious, but if we make it an order, hopefully that'll trip a lot of folks over the line, and maybe they'll start doing a little better job of trying to take care of their family. I hope.
Madam Chair, Jane?
Yes, Jane, go ahead.
I just had a quick question for Russ, and that is, at our last meeting when we all decided that we would go with an advisory as opposed to an order. Did you get any encouragement, any communication back from the folks that we were trying to accommodate?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Yeah, I did. I got feedback from, it was mainly the visits in Elmore County with the cities and the commissioners. And, the sense I got that they were willing to help promote that for sure. I think, what Chairwoman Nettleton just described, she was seeing some improvement, noticeable improvement in Mountain Home in many sectors. We also heard from some of the retailers and some of the businesses that they were taking the advisory seriously and implementing the steps we recommended. So I don't think it was ignored by any stretch, but at this point, I do feel that it's time to go ahead and make that transition again, given the public opportunity for input. Much of what will be included in the order our communities are already familiar with. Masking is the big one, clearly, and I don't think it's going to be an undue hardship. I can't think of a situation where we're going to require that a business close, although they're going to have to definitely change their business operations, much like they did back with the stay-home orders and the various phases coming out of that.
Betty Ann, hearing no further discussion, I'm ready to alter the original motion and amend it.
Okay, Ted, go ahead.
Yeah, I would make the motion that we move from a public health advisory to a public health order. We accelerate the timeline so that Russ has time with his staff to prepare this and show it to the public so that we can discuss this order on Friday. I know we'll need a separate motion for another meeting on Friday, but for Friday at 5:15, we could meet again. So in summary, it would be, the motion would be to move from a public health advisory to a public health order to entertain both four-county consistency with this, as well as an enforcement mechanism with this as well, and that we make sure the public is informed and shown, and that we take this up on Friday as a board action.
Okay, the motion has been heard. Is there a second to the amended motion?
Madam Chair, this is Eld. I'll second. I think Jane, we lost Jane.
Jane, are you there? Not here.
Madam Chair, Jane, Dr. Young did drop off, and it looks like Commissioner Sturm's back on. Just wanted to make you aware.
Okay, so Jane is off, but Ryan's back on. Is that correct?
Correct.
Okay. All right, the motion has been made and seconded. Is there any further discussion to the last motion by Dr. Epperly? Hearing none, I will call for a vote by county. Ryan, did you get to hear that motion?
Commissioner Sturm, you're still on mute. Madam Chair, I'm not sure. He is definitely back on, but mute button still showing, and also Dr. Young's back on.
Okay, I want to make sure that Ryan does understand the most recent motion. So, Dustin, can you help us?
Madam Chair, this is Jane. Did the motion change in between when my computer went out?
There was, yes, there was an amended motion, and Commissioner Sturm was off too. I'm not hearing from him, so I want to make sure there's full understanding of the most recent motion before we move ahead.
Jane, just, Madam Chair, if I can just explain to Jane. Jane, what we did while you dropped off was kept the same motion, moving it from an advisory to an order, but with the preparation time so that the public would be notified and that we could take this up as a board on Friday, 5:15.
Great, thank you.
Okay. Ryan, are you there? Boise County? Well, unfortunately, I'm not hearing, so we must move ahead with a vote. There's no further discussion. Not hearing from Boise County, I will proceed with Valley County.
Commissioner Hasbrook, aye.
Elmore County.
Representative Blanksma votes no.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Mr. Laciando, aye.
Okay, the motion does pass. So, Russ, you will have that document ready for presentation if we go ahead and meet again Friday, correct?
Absolutely.
Okay. Russ, do we need a motion to change our schedule a special meeting for Ryan at this time, or for Friday at this time?
Yes, you will designate, it'll be designated as a special meeting for Friday. I would recommend the same time at 5:15. And it'd be really, it'd be great if the board could go ahead and do that this evening, just so the public is aware this is the formally being changed and the reasons we're having the special meeting.
Right, okay, that's December 5th at 5:15, right? Do I have a motion to that effect?
Madam Chair, this is Elt. I'll make that motion.
Okay, thank you, Elt. The motion has been made. Is there a second?
Betty Ann, this is Ted Epperly. I'll second that motion.
Okay, any further discussion before we move forward with a vote? Hearing, oh, I'm sorry. My husband just chimed in with a correction that Friday is actually the 4th and not the 5th. So I thank you for that interruption. So we would, you want to go ahead and amend that motion as was stated for the...
I'll amend my motion, Madam Chair, to December 4th, 5:15.
Okay. All right. Thank you. Thank you. Okay.
Betty Ann, I'll second that amended motion. Ted Epperly.
Okay. Forward with the vote. Boise County, are you back on again? I don't hear him. Okay, Valley County.
Commissioner Hasbrook, aye.
Okay, Elmore County.
Representative Blanksma, aye.
Ada County.
Ted Epperly, aye.
Jane. Dr. Young, are you there? Jane? Diana, Commissioner Lacchiando, are you there?
Yep, Commissioner Lachando, aye.
Okay. Jane Young, are you back on? I guess not. So we do have 4 ayes, so the motion does pass. That our next meeting will be held at 5:15 on December 4th. Any further discussion before I move to call for a motion for adjournment tonight?
Madam Chair, this is Al.
Al, go ahead.
Yes, if you don't mind, Madam Chair, I'd like to ask Representative Blanksma if she has any other ideas besides the way we're going now.
I have, Madam Chairwoman, Commissioner
Yes.
Hasbrook, I have great discomfort with going forward so quickly with such a massive mandate. I understand the concerns. That's my issue at this point, and I guess I'll reserve further judgment until Friday.
Thank you, Megan.
Okay. Do I have a motion for adjournment?
Madam Chair, this is, go ahead, Diana.
All right, Madam Chair, I move we adjourn.
Okay, thank you. A motion for adjournment has been made. Is there a second?
Madam Chair, Ted Epperly, I'll second.
Okay, thank you, Ted. Before I move forward with the vote, starting with Boise County, are you there, Ryan? No. Valor County?
Commissioner Hasbrook, aye.
Elmore County?
Representative Blanksma votes aye.
Ada County?
Jane Young, aye.
Ted Epperly, aye.
Commissioner Lachando, aye.
Okay, motion does pass for adjournment. Thank you to the public who has chimed in and participated in our meeting. We do appreciate your participation. Our next meeting will be at December 4th at 5:15. So thank you, everyone, and good evening.